Thank you. So first, I want to acknowledge that this is a bit of a strange session for a couple of reasons. One is I don't have a practitioner teammate to be able to rely on, so I'm going to address that in a minute. I also recognize that this is in Nepal. Many of you might not have been there before. It's near India. And you might say, well, what does that have to do with Africa? So I'm going to talk about that as well. And the third thing is that I think that this is important for one of the reasons in which sometimes you start out with a really great idea that you're very passionate about a program, as I did several years ago, and you find out after doing the experiment that it might not be as good of an idea as you started with. And so I think it's really important when we talk about randomized evaluations and we talk about what works, that we're also putting equal weight on what we're finding out that doesn't work. And so I think that that's important, that both sets of results get out and that we know how to address them. So given that, I'm going to talk about menstruation and the barriers to education and try to relate it into Africa and some of the policy debates that are going on now in several countries throughout Africa. So first, women face many restrictions and challenges during their menstrual periods, and some of those are health-related. They might feel achy and crampy. Some of those might be cultural, that there might be taboos or restrictions on their mobility, and there might be also logistical issues, that they don't have sanitary products or they've got to deal with menstrual blood. Okay, so now we're going to get really into menstrual blood right before lunch. Hopefully everyone's comfortable with that. I have pictures, but don't worry, they're not. I don't need warnings about graphical pictures. Okay, so in the developing world and in many rural areas, modern sanitary products such as pads or tampons, they're not available, they're not readily available, or they're prohibitively expensive. And so most women in those areas, they use cloths. They're claimed to be less sanitary. They need to be changed often. You need time to wash them, and sometimes they're not so private because you have to hang them up. And so that feeds into this culture of taboos or restrictions against women during their periods. And so the research question that we posed was, does providing modern sanitary products help increase girls' attendance in school? There are many reasons why we picked this question, one of which is that this has become a very hot topic with many development organizations promoting girls in school, and we really wanted to be able to test that out. So there's been a significant focus on this. The World Bank came out with a figure. They claimed that girls miss 10 to 20% of school days during their period. That was actually not coming from any evidence there. That's coming from an upper bound of if girls were to miss every single day of their period when they were going to school, this would be the amount that they would miss from school. And so that was cited as why this might be a potential problem. There's lots of anecdotal evidence that school is missed due to periods, and girls complain about this. And there's been a lot of policy responses. So campaigns have been started. Clinton Foundation, always NGOs. I'll show you an ad that focuses on South African women. But a lot of money has been starting to being put into sanitary products for girls. So girls might miss some school, but how much? Rigorous evidence about how much there is. So first question is, why don't we know the answers? There's lots of work on this. It seems pretty, there's lots of work on schooling. Why don't we know the answers? So the first reason is that we lack data. So even though we've got lots of schooling data, and we've been collecting data from kids on their attendance for decades now, that we don't know when their girls are actually having their period. And so there hasn't been a link of are they menstruating and are they missing school during their period. And so that lack of data is one challenge. Can't we just ask the girls or teachers? Many researchers, lots of them go out, they ask girls, they say, is this a problem? Do you miss school? Lots of times research will ask teachers, is this a problem in your school? But you can imagine that this response, that girls might either feel shy to say this is a problem, and so they might underreport it, or they might say, oh wow, this is a project that's coming in to give our school some sanitary pads, and wouldn't it be great, we need this project here. So there might also be over-reporting of how much this is a problem. And then the third thing where I've seen some people do is, can't we just compare schooling of girls who have sanitary products with those that don't? So let's say, and I'm sure I don't need to dwell on this much, but let's say we just took some data and we've got data from a cross-sectional data set of girls who have sanitary products, and we look at their absentee rate, and we look at girls who don't have sanitary products and look at their absentee rate and just compare that. And wow, that would really show us that the absentee rate for those with sanitary products is much lower. But instead, those girls are most likely from higher income households, they live in more urban areas, and so we're not seeing the true causal effect of the sanitary products. So then the second question is, doesn't somebody know these answers? Why are they trying to promote this all over? And it's interesting to think about who reports about menstruation and education in developing countries. And this is an advertisement from Always Tampax, Being a Girl. This is a big campaign that showed South African girls who they claimed were having big problems with their menstrual cycles and getting to school. And who produced this, and who was a co-founder, was Always in Tampax, where they were trying to promote individuals from the West to buy their products to help out South African women. And so lots of the reasons and incentives for reporting this might not be coming from rigorous evidence, but coming from other types of motivation to help out girls. So how do we study this question and study how do modern sanitary products help girls to stay in school or not? Is that we did a randomized evaluation about menstrual cups, which I'll talk about in just a minute. So we gave out modern sanitary products to adolescent girls in Nepal. And so we had 4 schools. This was a small study, and also an example of you can do research with a limited budget. This was a small study in 4 schools. We still had enough statistical power to do it. It didn't cost us lots and lots of money to do this. Okay, so what we did was we had 7th and 8th grade girls who were invited to a baseline meeting, and they were invited to bring their mother or an older female guardian. That helped us with consenting with this process. And there was an initial meeting in which they came in and did a baseline survey with the mothers and the girls. And after the baseline survey, there was a public randomization in which numbers were pulled out of a hat or a bucket, and they assigned people into treatment or control. Now, everyone knew who was in the treatment or control. We then asked the control girls, and their mothers said, "Thank you very much for participating in this meeting." And then after that, we held additional training sessions for the treatment girls. So what happened? With these treatment girls who were randomly assigned with their mother, they stayed at this meeting and they received a free modern sanitary product and instructions on how to use it. So what are these? These are menstrual cups. These are FDA approved in the United States. They're available throughout Europe. There's now a company that's producing them in South Africa. They're silicone based, they're squishy, and they can be folded, inserted in the vagina, and then it holds menstrual blood during the day. So it's dumped out each day and washed out, and it's reusable. One of these is reusable for up to 10 years. There's some learning involved, and I'll talk a little bit about how this affected our population of these young schoolgirls. But the idea would be, when I first started out, was that this could be a great intervention, fairly cheap, and if it had an impact on schooling, this would be a great thing to be able to roll out to rural women. Okay, so the rest of the research design. After we trained the girls and the women about this menstrual cup, we also told them that they shouldn't share their cup. We explained that the control girls would be getting the cup in the next year. And we followed these, all of the girls for about 15 months. And that involved monthly school visits by a nurse that would talk to both the treatment girls and the control girls about when they were having their periods during the month. They would also ask about whether or not they used or tried this cup and if they had any problems with it. The girls also filled out time diaries for about 6 days of each month, where they would report what they were doing during the day, and they would report all the activities that they would do each hour of the day. And then we also, at the end of this time, we collected a follow-up study in which we also found out information from the girls and the mothers. I should just talk briefly also the other outcome variables that I'll be talking about is that we collected school attendance in 2 different ways, actually 3. I'll be showing you results from 2 of these. School attendance were collected from the official registers at these schools. We also have school attendance data from the girls themselves from time diaries, and we collected random checks in which we would show up randomly at the school and collect their attendance throughout this time. I'll talk briefly about test scores and other things as well. So the first question is, what is school participation like during girls' periods? How does the period affect schooling and attendance? The first thing is from the baseline survey. So the baseline, they were asked, did you miss school in the last year due to your period? 47% said that they did. So this is one number that's similar to other studies that report that this is a big problem. But the problem with this is that even though this might affect a vast majority, or about half of the girls in the study, it doesn't tell us how much school that they're actually missing. Are they missing 10 days due to the period, or are they missing an hour due to the period? This just tells us in terms of what % might be affected. So what we do is we're going to look at the probability of attending on the days that we observe for the attendance as a function of whether or not they're having the period. Now, this here, first off, is not relying, I'm going to show you the randomization in a minute, but this here is not relying on the randomization of the cups yet. I'm just going to show you how much does the period itself affect. So this is only going to be among the control girls who did not get the cup. So what we find is in this regression, this is comparing the likelihood of when the same girl has her period and when she doesn't have her period, what's the likelihood that she shows up for school on that day. And what we find is two things. We've got a negative effect, so from either the official data or the time diary data, we've got a negative 0.024 or negative 0.043. So that means that on period days, girls are between 2.4 percentage points and 4.3 percentage points less likely to be in school. And there are little stars on that, which means that it's also statistically significant. So that means periods, the girls, when they're having the periods, are less likely to be in school. Now, if we back that out in terms of, this is just per day, if we back that out to the fact that girls are having about between 4 and 5 days per month of period, she's about between 2.4 and 4.3 percentage points less likely to be there. What that means is an impact of between 0.35 days and 0.6 days of schooling missed due to the period. That's not a lot. So, to recap, this is just using the period data. Periods seem to be bad for women, but not that bad. Okay, so now let's see about the menstrual cups. What happened with the menstrual cups? First, did they use it? This randomized control trial wouldn't really tell us much if they just kind of looked at this little cup and said, we're not going to use it. The second question is, did the cup, did this modern sanitary product, did that help to close this small gap in attendance? And the third is, if we find anything or if we don't, are there any other benefits that we're not picking up through the attendance or through schooling that might be caused from the cup? So this first graph shows you from 2 months after the project started in January 2007 up to the end of when we collected these monthly data from the school nurse about trying the cup and actually using the cup. So the blue line indicates the % of the girls who tried the cup each month, and the red line says which % actually used it. So sometimes they would try it. These are young girls who have just started menstruating. They're about 13 and 14 years old. Did they try it? Did they use it? And it took some time in order to learn how to use this cup and insert this device. It's not that easy when you're a young girl. But overall, by the end of the study, about 60% of these girls were adopting. And actually, these are quite fast adoption rates in comparison to other types of technologies. So now let's look at the impact of what happened with the cup on period days and non-period days between treatment and control. And I'm going to show you two different things. Don't fret if you don't like these regression equations. I'm going to show you a picture too. So the first one is just going to say, what's the difference in attendance between girls who are in the treatment group who got the cup and girls in the control? And the second is going to say, well, let's look instead by period days. That overall attendance might not be the important thing, but on period days, what's the difference between girls who got the cup and girls who didn't? So if we look at this, and we're going to look at two different data sources, the official attendance data and the time diary data, the first column and the third column says, what's the overall difference in attendance on just between treatment and control? And you don't see any stars there, and it's a very small number, saying there's no statistical difference, and it's a small magnitude in terms of the difference in attendance between treatment and control girls. Well, now let's look at period days. So here we've got, on the second column and the fourth column, we see, again, this is our effect of the period. The period is bad for the control girls, but that the girls in the treatment group are not seeing additional gains from the cup. And so just to see this in a picture, if we look at the treatment girls and the control girls, between period days and non-period days, both treatment girls and control girls see this small reduction in attendance when they have their period. It's not the case that the girls who got the cups have got attendance that is equal on period and non-period days. So it doesn't appear that in these results that the cup had any impact on helping overcome the small gaps due to the period. So we looked at other things as well. So there was no impact on religious worship. There was a lot of reduction in religious worship during the period. There was no impact of the menstrual cup on cooking, making tea, on personal care. The one effect that we found, and this was, I guess I shouldn't have been surprised, but after working on this project for years, I felt a little bit silly that this was the one big effect of the menstrual cup was on laundry time. And so what happens is that on period days, girls spend approximately 22 minutes a day washing clothes. And the cup helps to completely eliminate all of that washing time. Now, I've done the cost-effectiveness analysis of 10 years of the cup with 20 minutes extra a day, and it actually does seem to be cost-effective, but that seems a little bit silly for these girls. Other effects. We thought the test scores might have been impacted because girls don't have to worry about leaking, and they might be able to concentrate more. There's no impact. Nothing on gynecological health in terms of discharge, pain, cramps, PMS. Nothing on questions about empowerment or self-esteem. Now that noted, these questions on empowerment and self-esteem were asked at a follow-up survey in which it was pretty fun to hang out with all of your friends and answer questions and get some nail polish from your survey enumerators. And they weren't asked at the homes when they might be feeling a little bit down. So that I take with a bit of caution. We also, girls who reported more cramps, we looked at a couple days before they started menstruating to see if there was PMS effects. There's really nothing at all going on in terms of effects of the period. So, in conclusion, the women liked these modern sanitary products. It helped them out a lot. They talked a lot about being able to bicycle, about increased mobility. There was high level rates of adoption. The control girls who then got the cups 15 months later, they liked it as well. They had high levels of adoption, but there was no impact on school attendance. And what's important here that I think is that not only was there no impact on school attendance, but the data from the periods itself indicate that although there's a slight decrease in attendance rates on period days, it's actually not that big. So about a half a day of schooling missed due to periods. And when the girls were talking about what's the worst thing about the period, what they really complained about were cramps, and that they just didn't feel very good. And so it might be that just giving a little bit of ibuprofen might help with that 1/2 day of schooling. On the other hand, if we think about what's really effective for education, there might be many other programs that we're going to hear about and that you might know of that might be more effective for what we should be concentrating on. Now that said, this is in Nepal. It might be that there's differences in Africa. It's not clear. There's studies that are going on, but I think that there needs to be some caution about the types of studies that people take on, and do they think that they're going to have big impacts? And if there are big impacts, maybe to focus on some of the programs that might give us a big return. Thank you.